I know so many gynecologists who say कि वजन कम करो PCOS ठीक हो जाएगा. How much of it is actually true?
Weight loss is just one part of that puzzle. Insulin sensitivity can be reduced with a good diet. That means less of carbs, less of processed food, eat different colored vegetables. They have a lot of phytonutrients.
And what's the most interesting teenage case that has come to you ever?
I have treated a few girls who've come to me with severe pain abdomen.
Factors like stress and just combating it with yoga and stuff like that is just so less spoken about.
Absolutely. Whenever you get time, get into more mindfulness, get into yoga, get into therapy. Make your life more meaningful.
Symptoms of perimenopause.
Irregular periods, bone aches and pains, mood swings. In our society, in our households, people think it's only the lady who has the problem.
Yeah.
When it's not true. No woman should get upset because of this.
Yeah.
Life starts after 50.
Hello and welcome to yet another episode of the Namya podcast by Ridhima. Today we have a very special guest called Dr. Bandana Sodhi. She's worked in the field of gynecology for over 35 years. She's currently working with Fortis Hospital, New Delhi as Director Gynecology. She's a pioneer when it comes to robotics and laparoscopy. She's also worked for Army for a significant part of her life. Today, she talks a lot about PCOS, PCOD. How does a woman's life look like from menarche to menopause? What are the challenges that she faces? Infertility, egg freezing, menopause and stages of menopause. If you have somebody in your family who's facing PCOS, PCOD, in fact, it's a podcast that every woman should must watch. So share it with your girlfriends, your family, your mother, sisters, and everyone that you know. And as I always say, prevention is better than cure. Thank you so much, Dr. Bandana ma'am, to join today. I think it's a pleasure for us to have you on the show.
Pleasure's mine.
Absolutely. Because we have you on the podcast today, I really want to take this time to cover all the important topics that we feel our audience need. So I wanted to first start, with what happens with teenage girls, because the objective of the podcast is to cover everything, all the important stages from menarche to menopause. Literally every stage that a woman goes through, right? For all the parents who are watching, who have teenage girls, what is it that you will tell them? Because I know a lot of these girls very early on today have PCOS and PCOD, and most of it gets missed. Because I remember when I had my first period, it took me literally 12 months to get my cycles in place. So at what stage can someone say that my teenage child or teenage daughter has PCOS or PCOD?
Yeah. So, as you said, we'll cover everything, right from menarche till menopause and thereafter also. So, teenage is an age where the girl is going through a lot of changes in her life. And her best support is her parents. So the parents need to understand what she's going through and what all hormonal changes are happening, what all emotional changes are happening, and bodily, physically, mentally, emotionally. So everything needs to be looked into. Nowadays, if we see, the girls, they are more homebound because of pressures of academics. They are more onto their Insta reels.
Absolutely.
They're more onto their phones rather than doing any physical activity. So these are things which have actually set into their system, which has led to onset of hormonal changes earlier than what used to happen in earlier times, when the girls used to go, all children, boys and girls, used to go and play outside. There was some amount of physical activity. Evening hours, I still remember when we were kids, we would go in the evening and play with our other friends outside. Maybe badminton, maybe basketball, whatever. But I don't see that happening now. So all these things have now changed the perspective completely. Early onset of menarche has happened, and physical activity has reduced. So onset of early signs of PCOS have been setting in now. So the parents need to be aware that these are the red flags now when the cycles become irregular for a longer duration, not for a shorter duration. Initially, as a physiology, it is very important to understand that the initial few years the cycles will be a little irregular. As you yourself said, it took 12 months. So the initial bit is not to panic, but if it continues along with other symptoms like obesity, or if she is developing unnecessary hair on unwanted areas in her body, and she's having unusual acne. Puberty acne are normal, but these acne are different. So if these things keep persisting and the cyclicity keeps persisting through her teen years till the time she's about 17, 18, then definitely the parents need to understand that this needs to be looked into and needs a little early intervention in comparison to maybe just ignoring it. So awareness amongst parents is best. Also, the kind of food that kids are eating these days, I would say they are eating ultra processed food.
Absolutely.
Right. So this ultra processed food is not nutritious in any way. So there's hardly any vitamins, there's hardly any antioxidants going into the system. So there's another factor which parents really need to look into.
Right. And what are the tests that the parent can take for their daughters at this age, so that they know whether she has a PCOS or a PCOD or not?
All right. So the tests, they can be thyroid tests. You can do a basic ultrasound for her ovaries, which may show a pattern of polycystic ovaries, but at this young an age, sometimes it may not show up as a classical pattern.
Okay.
It may just show up as multicystic ovaries, which are normal ovaries at this stage. So they are not harmful. They normalize. Multicystic ovaries normalize as the girl grows.
Okay.
But if it is a classical PCOD pattern on an ultrasound, then we can catch it early, treat it early, prevent complications later. Right.
Are there any additional tests along with ultrasound to kind of clarify whether she certainly has PCOS or PCOD or not?
You have insulin resistance tests. You can do a fasting insulin and a postprandial insulin test.
Okay.
You can do, as I said, other causes for irregular periods like a thyroid dysfunction or hyperprolactinemia, prolactin test. These are the other causes for irregular cycles, not just PCOS. So they can all be done, but just give her a year or two to settle down before you jump onto tests and rather create a lot of stress for the girl also.
Right. And what's your take on contraceptive pills being given to teenage girls? Because, we do a T for PCOS, and a lot of these young girls come to us and ask us about the T. And while we are inquiring about their diet, we also understand that they've been given contraceptive pills. Do you recommend that at this early an age?
Not in the beginning. As soon as she starts her menarche, we don't recommend contraceptive pills at such an early stage, because we call it the hypothalamic pituitary ovarian axis. That is the hormonal axis, right from the brain right down to your reproductive system. So it's still in the maturing stage, and we do not unnecessarily overload her with hormones initially. But towards the latter half of her teens, if she's developing symptoms like acne, or she's developing other skin disorders, or maybe painful periods, we may put her on a short term of birth control pills from a medicinal point of view. Yeah.
What is the basic function of a birth control pill? How does this help?
The birth control pill, basically, it suppresses the ovulation, right? And it reduces the androgenic effects which are there because of a PCOS. So it improves the acne. So because androgens, they work on the oil glands, which causes the formation of acne. Secondly, the facial hair will also reduce once the androgens reduce. Cyclicity is set in. The cycles become regular. So symptom control is attained. You're not treating the root cause, but you're treating the girl symptomatically at that stage.
Got it.
Right.
Understand. And, I've heard a lot of times that these are not permanent solutions. In fact, I know some of my family members who took it and had extreme side effects like excessive hair fall and things like that. For a girl who's 16, is probably prepping for her exams in 11th and 12th and has a lot of pressure to clear NEET and IIT JEE and whatnot, what would be your 3 best advices for that girl?
Firstly, lifestyle, rather than be on pills or something.
Yeah.
If she starts early in life, maybe a little bit of physical activity, maybe eating right, that would definitely help her in de-stressing as well as maintaining her internal milieu. Right?
Okay.
So that is the first thing that she should do. Stress plays a very major role in this transitional phase that the girls are going through. So the transition of academics, the transition of growing up, the transition of looking good, all these things are there at this age.
Right.
So definitely stress management is very, very important. That's the first thing. I wouldn't straight away put her on a pill. Personally, I'd never do that. I concentrate more on the other factors, a holistic approach rather than just putting a girl on birth control pills that ठीक हो जाएंगे cycles. Unless of course she has very painful periods, then definitely I would give her this for a few months so that she's pain free for a while.
Okay. Okay. And what's the most interesting teenage case that has come to you ever?
Teenage case as far as PCOS is concerned or just otherwise?
Just otherwise, any case.
I have treated a few girls who've come to me with severe pain abdomen, and we have evaluated, and they've turned out to be an ovarian torsion. So in a young girl, in fact, I've treated a 9-year-old girl with an ovarian torsion. Her mother came to me saying that, whenever she plays and she's just 9, and whenever she goes to play, then she complains of severe pain in the lower abdomen. And when she rests, she settles down. So we've been seeing a physician for that. So we evaluated. I did a laparoscopy for her.
Okay.
We found a torsion of the ovarian pedicle.
And for all our audience, if you could explain, what does that mean?
Torsion means when, the ovaries are the reproductive organs for a woman. So out of the reproductive organs, it is the ovaries which produce the eggs. And they are attached to the uterus through a pedicle.
Yeah.
So sometimes if the pedicle is a little long, sometimes, otherwise also sometimes, it can rotate on itself.
Wow.
So it's a torsion, it's a twisting.
Okay.
So this twisting can present as an emergency,
Okay.
and this we call as an ovarian torsion.
Wow.
So it can present at any age of life.
Right.
So in young girls especially, if it twists on itself, it can present with acute pain.
Wow. Okay.
So as I said, I treated this 9-year-old girl. I can never forget her. Because after that, after the surgery, we did a surgery, we derotated, we fixed her ovary. She's been the happiest child, and now she's in college in the US.
Wow, so cool. And talking about pain, I was reading that almost 50 to 60% of the endometriotic cases actually get missed by even doctors because it just gets misconceived as IBS or just bloating.
Yes.
What are the early symptoms of endometriosis, and how does one recognize it first?
Yes.
And then what are the preventions or cure for endometriosis?
I think that's a wonderful question, because this is one thing which we all need to be aware of. Don't take period pain as a normal pain. That's what my message to everybody around is. Period pain, if it is severe, needs to be addressed. Normally, when a girl is growing or even in the reproductive age, koi baat nahi, it's happening, doesn't matter, it's one of those things. So, it's not to be taken like that. So, don't normalize period pain. That could be one of the underlying causes for endometriosis.
Okay.
Right? So, we miss out endometriosis if we don't look further into it, we delve further into it. We need to do that. And endometriosis is a condition which can at times be very debilitating for a girl, for a young woman. So much so that they even have to miss work. They may have to miss school. And they don't take treatment for that. They don't speak about it because they're shy about it. But I would suggest if there is a period pain to whatever extent, see a gynecologist. Once you're evaluated, your ultrasound is done, you may pick up the endometriosis. In what form? In the form of a cyst, which could be there in the ovaries, which we call as chocolate cysts, or it could be just spread out around the uterus, which could be as nodules. And there is treatment for this. It can be treated medically and surgically, both.
Okay. And what is the treatment like? Medically and surgically, if you could explain both of them.
Medically, there are medicines which are available,
Okay.
which we have to give over a period of time, which suppresses the endometriosis.
Okay.
If there are cysts, it can reduce the size of the endometriosis.
Interesting.
And it settles the condition down so that the lady is able to lead a more normal life.
Okay.
Right.
Okay. And let's say, if endometriosis is, let's say, at an extreme stage, what are the procedures like? What exactly happens in that procedure?
Surgically.
Yeah.
Yeah. So if there is an ovarian cyst which has been diagnosed as an endometriotic cyst,
Yeah.
then we do not remove the ovary. We remove the cyst wall lining.
Okay.
We do a cystectomy. That means we remove the ovarian cyst, not the ovary. We leave the normal ovarian tissue behind.
Okay. Okay.
So that her fertility is maintained, her ovaries are still functional.
Got it. And is it a risky surgery?
Not at all. It can be done laparoscopically.
Okay.
And being a laparoscopic surgeon, I would say it's not risky at all.
Okay. Okay. Got it. You were talking about chocolate cyst.
Yes.
Is it different from other cysts?
Yes, chocolate cyst is layman nomenclature for an endometriotic cyst.
Okay.
Right?
Okay.
So this, why is it called a chocolate cyst? Because this cyst, the ovary becomes large with a cyst in it, which has altered blood in it. Right? It has altered hemosiderin granules and blood in it. So whenever we operate, the fluid that comes out of that appears like gooey chocolate.
Oh, okay.
Right? So
Okay.
it appears
So definitely not that sweet chocolate.
not at all, not at all, not to be
Got it.
mistaken for that.
I understand. Got it. I mean, any foods that you would suggest or any supplements that you would suggest for young girls looking at the kind of diet we have these days that can really help their, reproductive cycles?
Yes, absolutely. I feel diet plays a very, very important role in today's world, which most of us undermine. We don't take care of this.
Right.
Healthy foods. Now, it's very easy to say healthy foods, but what comes under healthy foods is basically more of phytonutrients, which are in your vegetables
Right.
and in your seeds,
Yeah.
and omega-3s, which again are there in your nuts, and vitamins, which go in through your vegetables again, proteins, which are a very, very important source for the whole body. Vegetarians have other sources, non-vegetarians have eggs and chicken, fish, and these are the things which we must eat rather than just processed food
Right.
and containing saturated fats.
Right.
And ghee, for that matter, is another thing which we also don't eat, but a little bit of ghee every day I think would
really do
suffice.
well.
Yes, would do well.
Got it. Talking about proteins, would you suggest whey protein to a young girl who's a teen?
That's again a little tricky. Whey proteins for young girls is not immediately suggested. Dietary sources would be the better option for a young girl.
I know a lot of these young teen girls, 15, 16, 17, who are now trying to become vegan. Is that something a child should do at that age? I mean, technically not a child, but again, still growing up. Would you suggest something like that, or you feel that, dairy products are important at that stage?
Dairy products are important because they're a rich source of calcium and protein. So going completely vegan I personally would not suggest that, because definitely it is required.
Okay.
Other milk sources like soy milk or almond milk would definitely not suffice to that much amount of a calcium. Or protein intake.
Got it. I now want to shift the conversation to slightly more mature women. Women like us who are working, are busy, haven't gotten settled. What are the challenges that you're seeing in women from age group 20 to 35? And I'm sure there are a lot of PCOS, PCOD cases coming to you. I've also seen so many of my friends who now have fibroids and other complications. So what are those top 3 complications that patients are coming to you with?
Okay, so this is the reproductive age group.
Yeah.
From the age of 20 to the age of 35, 38. And in this age group, there are many menstrual problems which are there. Commonest problems are irregular periods, second, painful periods, thirdly, PCOS. Fourthly, if they are married, sometimes we have infertility, they're not able to conceive.
Yeah.
So these are the commonest problems people come with. First is menstrual irregularities. They come with either irregular periods or heavy periods, or they have painful periods. These few things corroborate the menstrual irregularities.
Right.
So we need to understand why all this is happening. The commonest reason. The commonest causes that we have seen in this age group are either a polycystic ovary, or there are fibroids, or there is endometriosis, as we've already discussed. And of course, infertility is a different chapter in itself.
Yeah.
Right?
Yeah.
So once we evaluate and we find the underlying cause, we can definitely treat it.
Right.
So the main issue is to go to your doctor and see a doctor first as to why you're having these problems, and don't ignore it. If there are fibroids will cause painful periods. They may cause excessive flow during your periods. And I must say here that all fibroids do not need a surgery. The fear that people have after seeing their ultrasounds that, oh, fibroid is there, so what do I do? All fibroids don't need to be operated upon. If the fibroid is small, if it is just a few millimeters in size, or less than 4 centimeters or 3 centimeters, you can just leave it alone and just monitor it. It should not grow in size.
So if I have a 3 mm fibroid in my body, in my uterus, what are the dietary restrictions that I will have, or I should have rather, so that it does not grow? Or is it any which ways correlated or not?
Fibroids, 3 mm fibroid is a pea-sized fibroid, right? So that fibroid can be overlooked. It can be, your ultrasounds can monitor it. Fibroids are estrogen dependent. So foods which contain too much of estrogens, like soya, and they should be a little restricted. But a 3 mm fibroid is nothing to worry about.
Nothing to worry about.
Yes.
Got it. And what about PCOS and PCOD? I know a lot of women who go for an ultrasound, and basis the ultrasound only, they declare that they have PCOS, PCOD. Should one go for other hormonal tests also? And if yes, what are these tests?
See, PCOS, ultrasound criteria for diagnosing PCOS is one of the criteria. If we go scientifically, as per scientific criteria, one of the criteria is ultrasound. Plus, you may have other symptoms which you have to correlate with the ultrasound. You may have irregular cycles, like oligomenorrhea, which we call longer cycles, or you may have missed cycles. That is one thing, that is menstrual problems. Or if you have hyperandrogenism, that means when your male hormones are on the higher side. So you have features like unwanted facial hair or unwanted body hair which is there, and acne. So out of these three, if any of two are present, then you diagnose the girl as PCOS.
Okay.
And you also do blood tests, hormonal evaluations like a fasting insulin. You may do her testosterone levels to see how severe the case is.
Got it. So all these tests are critical to conclude whether somebody has a PCOS or a
Yes,
PCOD.
not just a simple ultrasound.
Got it. Understand. And now, since we are talking about PCOS and PCOD, what is the technical difference between the two? And is one of the two worse?
Okay, so normally in a normal conversation, we take PCOS as something which is interchangeable. But we need to understand that PCOS is polycystic ovarian syndrome. That's a more technical term, which includes the endocrine disturbances, the hormonal disturbances, and it includes the long-term systemic effects, which a PCOS can have. PCOD is a more descriptive term. It's a polycystic ovarian disease, and it just tells you a description that there is a polycystic ovary without covering the hormonal aspects to it.
Got it.
Right.
Understand. You know, it's so common that you will be pre-diabetic, you will be insulin insensitive, and you'll be probably obese or fat if you have PCOS. I think those are the 2-3 terms that have been overly abusive when it comes to PCOS.
Yes.
But I know so many lean women.
Yes.
I was reading about this concept called TOFI, which is, thin outside, fat inside. break this myth for us that you can have PCOS if you are thin or if you are on a leaner side.
Yes.
If you could help us technically understand that.
Yes, that's something really nice you asked, because I have young, thin girls coming to me with symptoms suggestive of a PCOS. So it is not a dictum that you have to be obese to have PCOS, or it is not that PCOS patients will always be obese. You have a category of patients which are called lean PCOS, who are thin built, they don't have extra body weight, but they have all the symptoms which are suggestive of a PCOS. They may have hyperandrogenism, they may have irregular cycles. So it is the hormonal changes which are taking place which lead to the symptoms of PCOS. They may not be overtly fat or have more adipose tissue. So calling a person who's obese having PCOS is not correlated always.
Always.
Yeah? So we need to evaluate, as we said, 3 criteria are there, which does not include obesity.
Right.
The 3 criteria, these
Absolutely.
are Rotterdam's criteria,
Absolutely.
which includes the ultrasound, the hyperandrogenism, and cyclicity. So obesity doesn't feature anywhere here. Right.
And a lot of times I've seen, in fact, some of these doctors, I come from a tier 2 city, and I know so many gynecologists who say ki wazan kam karo, PCOS theek ho jayega. How much of it is actually true, and what do you actually suggest so that PCOS, PCOD can be managed? Like, what are those 2-3 tips that you will give?
Okay. Weight loss is just one part of that puzzle.
Okay.
Right? It's just one thing. As a whole, it's not there. It's just one part of that entire syndrome, which we call. Weight loss, if done, we say about 5 to 10% or 7% of weight loss, if done, will definitely benefit you if you're on the higher side.
I'm
of
guessing
your
it's
weight.
to do with insulin insensitivity,
Yes,
because that will improve.
Absolutely. So the insulin sensitivity improves. So insulin sensitivity improving means your testosterone levels are reduced. It's a vicious cycle.
Right.
So weight loss means all these things can happen, but it's not the only thing. That's just one part. So the number on that scale is not the only thing that you're looking for. You're looking for other things also to be managed accordingly. Insulin sensitivity can be reduced with a good diet. That means less of carbs, less of processed food, choose more omega-3s, eat different colored vegetables. They have a lot of phytonutrients, and lean meats, they can be eaten, so that the diet adds on to reducing the insulin sensitivity. So it's not just the weight. And third thing is the mind. The mind needs to be worked upon.
Yeah.
The stress.
Yeah. I mean, when I was growing up, I was 86 kgs, and I kind of managed my PCOS back then. It was just weight loss, very strict regime, no food from outside. And I think factors like stress and, just combating it with yoga and stuff like that is just so less spoken about.
Absolutely.
And I mean, to me, that forms like the basis of how you live. And I think everything else is just a side effect of your stress and your lifestyle. In fact, I was reading this data somewhere that initially when, PCOS started to become a lot more common in studies and researches, they had figured out this cohort of BPO women where PCOS was most commonly seen. And I think the reason was their, time shifts and sedentary lifestyle. I think today, so many people I know who are working late night shifts and, working opposite hours, working for a US company. Is there any message that you would want to give to those people or girls, who are working literally opposite the timeline of the universe?
Yes, I get a lot of patients who are having a circadian rhythm which is changed like this because of the job responsibilities, right? So for these girls, I would say don't get disheartened. There are ways out. Whenever you get time, get into more mindfulness, get into yoga, get into therapy. Make your life more meaningful. Agreed, the job perspectives do require you to be awake at the odd hours.
Yeah.
But then whenever you get time, definitely take out time for yourself. And if you get the weekends off, go and do some exercise, go relax, chill out. And that would definitely change the mindset a little bit and reduce the stress. Because stress also increases your cortisols.
Yeah.
Cortisols increase your insulin sensitivity. So
Right.
again, the hormonal chaos
It's the same vicious
is there.
circle.
Yes.
Any one supplement that you would suggest these girls?
One
Somebody who
supplement-
has PCOS, PCOD, like something that they must have, kind of a
They
thing.
can take nutraceuticals like myoinositol.
Okay.
Yeah. So that definitely, I've seen it does wonders. And it's just a nutraceutical. It's not
Yeah.
a hormone at all. So I have seen a lot of changes in people who are taking myoinositol.
Okay.
Yes.
So, ma'am, we would like to shift the conversation to fertility issues and egg freezing, since a lot of our audience is between 25 and 35, who are taking our tea, have issues related to PCOS, PCOD, but are also planning pregnancy. I know a lot of people, who try maybe 2-3 times, and they directly rush to the doctor saying that, oh, it seems that the pregnancy is not happening. At what stage do we actually declare that this is a case of infertility?
Okay. Infertility can be emotionally very stressful. So when do we label a patient as having infertility? If a couple has been trying for 1 year
Okay.
to have a baby and they're still not able to conceive, or if the lady is more than 35 years and she's been trying for 6 months to have a baby and the couple is not able to have a baby, then we call it as infertility.
Infertility.
Not before that.
Not before
Right.
that. And what are the common factors that you're seeing in your practice that's leading to infertility right now?
One of the commonest reasons that we've come across is irregular cycles and an underlying polycystic ovaries. That is very common. 1 in every 10 women has PCOS.
Yeah.
And that is one of the major underlying causes for infertility. Apart from other things like endometriosis, which is again on the rise nowadays. A lot of patients come with endometriosis, maybe because of the underlying stress which is going on in our society. Then there are other reasons like blocked tubes or uterine problems. So these are the other reasons for infertility.
For women with PCOS, PCOD, like I know a few personally who had PCOS, PCOD but still conceived. How much of it is true? What are the factors involved? And what should a woman with PCOS and PCOD do if she's planning pregnancy?
Okay, the first thing is that you must understand that the statement that PCOS patients cannot conceive is a big myth.
Okay.
That needs to be debunked.
Okay.
Right.
Okay.
So PCOS patients can conceive, and I can tell you innumerable patients who have conceived. They may require a little bit of help, some medications, good guidance, and they can conceive.
Okay.
So that's the first thing.
Okay.
Second thing is, in PCOS, lifestyle changes matter a lot for conception. So as we've already reiterated, the kind of food you eat, the kind of exercises you do, losing about 5 to 7% of your body weight helps with the ovulation. So some of them are able to conceive naturally, even with these changes. Some of them may need ovulation induction medicines, provided the other factors are all right. That means fallopian tubes are functioning, the husband's report is normal, the uterus is normal, there are no problems in the uterus, provided all these others are eliminated, right? Then medicines can be given in the form of tablets, they can be given in the form of injections. Then we can have procedures which can help. If they've been trying for a couple of months and still not able, there is procedures like intrauterine insemination, which is not like IVF, something totally different. That can help during the ovulatory phases. And the last resort, of course, is only IVF, where everything else has failed. So we don't jump onto IVF straight away in patients who are having PCOS, because, as I said, it is not that they can't conceive. They can all conceive.
Conceive. Got it. And if you could help us understand both these procedures, IUI and IVF, technically, and when should one go for any of the two?
IUI is an intrauterine insemination. That means where we are helping the lady produce good eggs with medicines. We monitor them. The husband's sample is also taken on the day the egg releases, and that is prepared in a good media and nutrient media by the embryologist. And then we push it into the uterus directly. It's a short procedure, doesn't require admission, doesn't require any anesthesia, nothing. So it enhances the chances of fertility by about, say, 18%. IVF is something totally different. IVF is a procedure where you have to form multiple eggs with a lot of injections, and they have to be retrieved. Then the semen sample is added by the embryologist, and the embryos, they are made in the IVF lab, and that's in vitro fertilization. So in vitro is outside the body.
Outside the body, okay.
And then these embryos are later on implanted into the body. So it's a little tedious, but then it is one of the resorts if nothing else works.
Got it. And I've heard it's a very painful process. How long does it typically take?
It takes a couple of months. The first month would be retrieving the eggs and making the embryos. Then you make the lining. It's like you sow a seed, you make the lining. So it's the same thing. Okay. So it takes a couple of months. Emotionally, yes, it can be a little stressful, and it drains you out. But then if that is the only way out, then it has to be done.
There's a lot of it's, anything to do with infertility is always correlated to a women. There's just so less conversation about man being infertile. What are those interesting cases that you get? I mean, if you want to share any experiences that you've had, and what percentage of cases has a man being the reason for infertility for the patients that you get?
Yeah, so this is again a very, very pertinent question. In our society, in our households, people think it's only the lady who has the problem, and the man has none, when it's not true. So when a couple comes to us, I evaluate both. You have to get the husband also checked and tested. And there are, to my surprise, nowadays, we've seen that there is a rise of male factor infertility also. Either the sperm counts are less or the motility is less. So this factor also plays a very important role and needs to be looked into. I would suggest getting a treatment done if things are not okay with the husband too. And it could also be related to lifestyle again, smoking, stress, and not taking care of good diet. That also has affected the male factor itself. So definitely this needs a major look into, right? And the mindset of the mother-in-laws also needs to be changed for that.
Absolutely. I mean, since you do it day in, day out, how do you preserve your sanity from all these things? Because I'm sure, I think it's a field where you would see a lot of gender bias and a lot of things that we thought are probably not in today's world, but it is happening even today.
Yes, it is happening. So you call the mother-in-laws along and you tell them that everything needs to be worked upon, both of them. And they do understand at times. But sometimes they say, nahi, iska test baad mein karao. So it's like that. Yeah.
Got it. I also want to touch upon women, who are working, ambitious, haven't found the one, and want to explore the procedure of egg freezing. At what stage and age would you suggest that? And what are the chances of fertility in case of egg freezing?
Again, social egg freezing is a big topic nowadays, right? Yeah. So egg freezing is being promoted in a big way now. Why? Because a lot of women, because of their career options, they want to reach a good career in their lives, and why not? Yes. Yeah. So because of that, they don't work upon themselves, right? So they miss out the right time of getting married and having their babies. So since the biological clock, it keeps ticking for a woman, you need to understand that the eggs will also keep reducing as the age increases, and so also the quality of the eggs. So if a lady is not married or after wedding also, she doesn't want to have a baby soon, she wants her career perspectives to be on the higher side, then social egg freezing is recommended, and it is successful. Earlier done, the better, because the quality of the eggs is better.
Yeah.
So these eggs can be preserved, and whenever the couple wants to have a baby, or later on whenever she gets married, she wants to have her babies,
Yeah.
these eggs can be fertilized.
Got it. And there's something called embryo freezing as well. What is the difference between the two, and which one should one prefer if they already have a partner?
Yes, if in our country, the marital status matters.
Okay.
So to have an embryo frozen, you need to be married.
Oh, okay. So
So-
that's a it's a rule that you have to follow. You're saying.
Yes.
Okay,
So they would, they wouldn't
Allow.
fertilize the eggs without a lady being married.
Interesting.
So you can freeze the embryos if a couple is married and they don't want to have children right now and they want to go in for egg freezing. We would suggest that you go in for an embryo freezing rather than an egg freezing. That's a better option, because once you fertilize the eggs later, after you thaw the frozen eggs, then definitely the results would be lesser than expected, because
Got it.
something being frozen is thawed and then fertilized.
Right.
So it's better to freeze the embryos
And
rather than freeze the eggs alone.
got it.
Yeah.
And what is the right age for egg freezing?
Any age between 30 to 35 would be
Is it
the
good?
ideal age to do that.
Got it. And what are the success rates like?
Success rates are about 50%,
About 50%.
like the success rates of an IVF procedure.
IVF. Okay, got it. Understand. Since we're discussing these issues at this age, I want to understand a little bit on pap smear,
Yes.
and when should we get it done? Why is it so important? And how should we get ourselves checked for breast cancer, since it's just becoming so common?
This aspect of a lady's life is called preventive screening.
Okay.
Right. So pap smear and breast examinations come into preventive screening methods. Pap smear, what is pap smear? Pap smear is a screening of the cervix for cervical cancer. Cervical cancer is one of the commonest cancers in women, and the mortality and morbidity with that is very high. So if you screen the cervix, basically with it's just a small procedure. You just take a brush that's liquid-based cytology and you send it for screening.
Okay.
It can be done right from the age of 21.
Oh, 21.
Yes.
Wow, I
Till
didn't
the-
know about this.
Till the age of 65.
Okay.
So it's recommended once in 3 years. If you're doing once in 5 years till the age of 35, and thereafter every 3 years till the age of 65.
So till 35, once in 5 years, and then 3 years.
Yeah, and you may add on an HPV testing once in 5 years along with that.
Okay.
Right?
Okay.
So
And is it important
sometimes
that
they say it's
should-
not even recommended till the age of 35 unless you have symptoms.
Got it. Is HPV, because HPV again has a lot of preconceived notions about it, should one with multiple sexual partners do that, or should everybody go through a scanning for HPV?
Multiple sexual partners, definitely HPV screening is recommended.
Okay.
But once in 5 years, along with your pap smear, if you're doing it beyond the age of 35, then there's no harm in getting it done, because it's a combination duo test which is done.
Got it. Understand. Since we're talking about these tests, I also wanted to touch upon premenopause, or perimenopause, which has just become so common with women around 35 years, 36 years. I mean, I remember 20 years ago, it was probably in your mid-40s when you would get it. Why has this stage come so early on in everybody's life now?
Stress.
Stress.
Our lifestyle, our stress, your work pressures, working odd hours, all these things definitely take a toll on your body. Definitely. Yeah. So that's why the changes come in earlier.
Yeah.
And since we don't really care about ourselves, I think after COVID we should have all realized that taking care of your own body is something so important. Take out time for your own self.
Yeah.
It's so important.
Right. What do you do personally to take care of yourself? I'm sure you have like crazy work schedules.
Absolutely. There's just no time. There are odd hours.
Yeah.
And I really don't practice what I preach. So,
But one ritual that you can't live without, which you think is healthy as well.
a de-stressor is required. And for me, I have a little dog who's my biggest de-stressor.
Okay, that's interesting. What are the early symptoms of perimenopause? Because a lot of people also confuse it with maybe PCOS, PCOD, because period flow has issues and stuff like that. But what are the actual symptoms of a perimenopause?
Perimenopause could present with irregular periods, and more towards the menopause, you could have hot flashes, you could have bone aches and pains, and mood swings, irritability, all these things, forgetfulness, mind fogging, all these things can happen towards when you're touching towards menopause. So these are all symptoms of perimenopause. Irregular cycles being the commonest.
And when should one say that the stage from perimenopause to menopause has shifted? Like, till what time should one not get the periods to say that now it's menopause?
Yes. They say that 12 months
12
of
months.
no periods
Okay.
around the age of menopause
Menopause.
equals menopause.
And what is happening in a woman's body biologically when a menopause occurs?
See, what happens is that the ovarian function keeps reducing as menopause is setting in. So, as the ovaries start, the function of the ovaries diminishes, the estrogens become lesser in the body.
Okay.
So, the hormone which is actually required for your bone health, your heart health, cardiac health, your skin, your well-being, your mental health is estrogen. So when this hormone starts reducing, that is when menopause sets in. So the ovarian function starts reducing.
Okay. And I mean, what diet or what are the things that you would suggest to somebody who's going through this phase?
In this phase, diet which is rich in phytonutrients and estrogens, that means soya products,
Okay.
they definitely have a little bit of something akin to estrogen, which are phytonutrients, isoflavones, and they actually would help you overcome these few turmoil phases, as we call. But it's actually, what I would say is that no woman should get upset because of this.
Yeah.
This is a short phase turmoil. Life starts after 50.
Okay. Let's talk a little more about that. So
Yeah.
you're saying that it's not the stop, it's actually freedom from here. Physically, I know a lot of women, because they get, I think, a little more fat around the abdominal area, they get a little bit conscious about their weight, their size at this stage. Is there something that they can do or alter in their diet at this stage?
Yes.
Or is it completely normal and they should just accept it and move on?
No. Any physical changes which are not acceptable to you should be worked upon.
Right.
So, commonest problem, as you said, the belly fat increases. Your metabolism slows down. So, and your androgenic hormones, they are on the higher side. So that is why when the androgens are on the higher side, your estrogens are reducing. So when the androgens are on the higher side, the belly fat tends to accumulate more. So that is why the symptom. So you have to work upon it. Exercise definitely has to be done.
Yeah.
Exercise maybe a little more than what you routinely do. And again, eating foods rich in antioxidants is something very important, and a high protein diet.
High protein.
Yes. This stage, proteins are very, very important for your muscle mass, for your body health, so that weakness doesn't set in.
I think it's also because the muscle mass drastically drops at this stage of your life.
It does.
Since you were talking about the life starts here, I want to understand for you personally, how was this phase like, and how do you feel now?
It's actually a state of mind. Yeah. So some people take it in the negative way. Oh God, periods have stopped.
Yeah.
What to do? Life has come to an end. No, it's not like this. You're free of your responsibilities.
Right.
You have the whole life ahead, looking ahead, and enjoy it. Look after yourself. Do exercise. Do yoga. Do mindful thinking. So all these things you can do with a free mind at this stage, and concentrate on your work and ambition as well.
Yeah.
And you can achieve wonders.
I'm sure we have a great example right in front of us.
So nice of you to say that.
So I'm going to now go to a very interesting section, which we call at Namya as rapid fire section, where you have to quickly answer some of these very interesting questions that I'm going to ask you, and you can skip if you want. So I'll start with the first question. Can you get pregnant on your period?
Normally, no.
Okay. Okay. One period myth you think is absolutely a bizarre.
Bizarre? I'll have to rethink this. We'll take it
Okay,
again.
we'll take it later. Birth control pills, a friend or a foe?
Both.
Both.
Yes.
Okay. What's worse for fertility, stress or sugar?
Sugar.
Sugar. One question every patient should ask their gynac, but they aren't asking this.
About menstrual irregularities, menstrual pain.
Okay. One food you would eat for your PCOS, or you would suggest every girl who has PCOS?
Antioxidants, nuts.
Nuts. Okay. Menopause, is it a liberation or a limitation? I think we have that answer
Yes.
already. One power breakfast that you swear by?
Proteins.
Proteins.
Yes.
Okay. One internet trend that you absolutely hate around PCOS, PCOD, or anything related to women?
Silly Insta reels.
Okay. If you could write one rule for all the women, what would that be?
Love yourself.
Love yourself. And one question for me, if you weren't a doctor today, what would you be?
Maybe a pilot.
Oh, wow. Clearly army background. With this, we end this conversation. Thank you so much, ma'am, for joining. I think it was a lovely, lovely conversation. I think people like us should get inspired by what you're doing. I think 35 years and doing such noble work for people. It's a pleasure for us to have you today. Thank you so much for joining.
It's been such a pleasure talking to you and learning so many things from you also.
Absolutely. Thank you.
Especially so when you said that you overcome the PCOS and you look beautiful today.
Thank you. Thank you.
It's such a wonderful being here. It's really wonderful.
Just one last question. If some of our customers and patients do want to reach out to you, what's the best way they can do?
You can share my phone number with them. You can.
Okay.
We can always share that on your.
Got it. We'll put your
website.
details on our podcast
Yes,
then.
you can
Thank
do
you so
that.
much. Thank
Yes.
you. Thank
You're
you.